A 43-year-old man presents to the emergency department with a 2-hour history of palpitations and shortness of breath. An ECG is performed at triage which shows an irregular, narrow complex tachyarrhythmia. Which of the following defines a narrow complex arrhythmia? Options are A. QRS duration less than 0.2 seconds. B. QRS duration less than 0.12 seconds. C. QRS duration equal to or less than 0.16 seconds. D. QRS duration less than 0.10 seconds. E. QRS duration less than 0.16 seconds. Answer is QRS duration less than 0.12 seconds. If a patient with a tachyarrhythmia is stable, the QRS duration should be considered. If the QRS duration is 0.12 seconds or greater, it is a broad complex tachycardia. If the QRS complex is less than 0.12 seconds, it is a narrow complex tachycardia. A 43-year-old man presents to the emergency department complaining of central chest pain radiating to the left arm and shoulder. Following investigation, he is diagnosed with non-ST elevation myocardial infarction. The medical team commence secondary prevention medications. Which of the following secondary prevention medications have been shown to reduce mortality in patients following myocardial infarction? Options are A. Clopidogrel, B. Angiotensin-converting enzyme, C. Calcium channel blockers, D. Beta-adrenoreceptor blockers, E. Furosemide. Answer is D. Beta-adrenoreceptor blockers. Treatment with a beta blocker, started early after acute myocardial infarction and continued, has been shown to reduce mortality. A 17-year-old girl presents to the emergency department following multiple syncopal episodes. She is found to have a prolonged QT on her ECG and she is referred to cardiology. You follow up her case a few days later and find she has been diagnosed with congenital long QT syndrome. What is the first-line management of this condition? Options are A. Flecainide, B. Amiodarone, C. Calcium channel blockers, D. Beta blockers, E. Digoxin 5. Answer is D. Beta blockers. The mainstay of treatment for long QTS, unless there is an identifiable reversible cause, is lifestyle modification and beta blocker therapy with the implantation of a cardioverter defibrillator in patients who have had a previous cardiac arrest and in those continuing to have symptoms despite beta blockade. As ventricular arrhythmias may arise during a state of high adrenergic tone, particularly increasing the occurrence of after depolarizations, beta blockers are used to blunt adrenergic stimulation. Beta blockers themselves will not shorten the QT interval, but their use is thought to prevent ventricular tachyarrhythmias. The efficacy of beta blockade may be assessed with exercise tolerance testing to ensure that the heart rate response is blunted.